Assalamu alaikum. Hello students. How are you? Hope that all of you are fine. I am also fine by the grace of Almighty Allah. Dear students, during to the outbreak of COVID-19, all of we are in home quarantine. We are passing through a critical time. I hope all of you are staying at home safely in this pandemic situation. Please follow the health rules instructed from WHO. These video classes will help you to continue your study at home. Welcome to my today's class. This is Mohsin Kabir, lecturer, Department of Biology, Milestone College. Today, I am going to discuss with you some topics from chapter 5, which is food, nutrition and digestion. Our today's topics are vitamin deficiency disease, absorption of digested food, assimilation, disease caused by intestinal disorder. After completing today's lesson, students will able to learn goiter, what is goiter, what is toxic goiter, what is xerophthalmia, what is anemia, what is assimilation, what is villi, explain the absorption of digested food and describe the diseases caused by intestinal disorder. So let's move to the main discussion. First one, vitamin deficiency disease. At first, I will discuss about goiter. What is goiter? Goiter is a disease of thyroid gland. The definition of goiter is swelling of thyroid gland due to the deficiency of iodine is called goiter. Goiter doesn't indicate any particular disease of thyroid gland. Rather, it is a general symptom for different diseases related to thyroid. That means thyroid gland can be enlarged abnormally due to the various reasons like tumors, cancer or other inflammation. But these are not goiters. Then toxic goiter. What is toxic goiter? The goiter occurs due to the excessive secretion of thyroxine is called toxic goiter. What is thyroxine? Thyroxine is a hormone which is secreted from thyroid gland. Due to the excessive secretion of thyroxine, toxic goiter is caused. Next one is night blindness. What is night blindness? Night blindness is a common problem in our country. The disease xerophthalmia occurs due to deficiency of vitamin A. If the deficiency is not treated properly, the level and intensity of the disease increases. There are 7 to 8 levels of xerophthalmia and the lowest level is called night blindness. Symptoms of night blindness. The patient cannot see in the dim light. Everything seems to be hazy. If the disease worsens, the cornea turns cloudy. Then prevention. What is the prevention of night blindness? Vitamin A enriched food such as fish liver oil, liver, green vegetables, yellow and orange fruits and vegetables, mola and dhela fish and vitamin A capsule should be taken to prevent this disease. Next one is rickets. What is rickets? Rickets is a disease basically found in children. The disease rickets occurs due to the deficiency of vitamin D. This vitamin is essential for the absorption of calcium and phosphorus in the intestine, formation of teeth and bones. Symptoms of rickets: weakening of the bones, swelling of joint, bending of bones, especially the leg bones. And then prevention: sunlight and vitamin D enriched food must be taken to prevent this disease. Next, anemia. What is anemia? Anemia is occurs when the density of hemoglobin is less than normal with respect to age and gender. This disease occurs due to the deficiency of the essential elements of food like iron, folic acid, and vitamin B12. What are the symptoms of anemia? Feeling weak, headache, depression, insomnia, loss of appetite, palpitation, vision suddenly goes dark. These are the symptoms of anemia. Prevention. What are the prevention of anemia? Iron enriched food should be taken to prevent this disease. Now, absorption of digested food. What is absorption? The process through which digested food enters into blood and lymph is called absorption. Absorption is basically take place in the villi of intestine, a small intestine. So what is villi? The inner surface of intestine is covered in finger-like projections is called villi. In singular form, villi is also known as villus. Villi contains capillary networks. Each villi or villus also contain lymphatic vessels in the middle, which is called lacteal. In the diagram you can see here, this one is the lacteal. Lacteal is surrounded by capillaries. You can easily see here, lacteal is surrounded by capillaries, blood capillaries. All of the blood capillaries and join together to form a large blood vessel, which is called hepatic portal vein. This hepatic portal vein carries the blood to the liver. At the time of the flowing blood, a kind of substances come out of the capillaries. This watery fluid is called lymph. Lymph is the important substance which plays an important role in transport. Lymph supplies nutrients to the cell and collects the waste products and return to the bloodstream. Assimilation. What is assimilation? The process of converting digested food substances into the constituents of protoplasm is called assimilation. It is an anabolic process. Through the action of enzymes, simple nutrients are converted into complex ingredients such as amino acid, glucose, fatty acid, and glycerol. Now, I am going to discuss about diseases caused by the intestinal disorder. And first one is dyspepsia. What is dyspepsia? Indigestion is known as dyspepsia. Causes: infection in stomach, depression, disease of pancreas, thyroid problems, enzyme deficiency, diabetes, etc. are the main causes of dyspepsia. What is the symptom of dyspepsia? Pain in the upper abdomen, feeling a full stomach, burning sensation in the chest, vomiting, chest pain, etc. are the main symptoms of dyspepsia. Prevention: avoid overeating, chew food slowly and properly, avoid smoking, and if necessary consult a physician to find out the cause and take medicine. Next one is dysentery. Dysentery is caused by the infection of protozoa named Entamoeba histolytica or by a bacteria named Shigella. What is the symptoms of dysentery? Frequent bowel elimination, abdominal pain, mucus and blood in the stool, and inability to digest dairy products are the symptoms of dysentery. What are the preventions? To drink pure water, wash fruits and vegetables carefully, wash hands with soap after passing stools, use sanitary napkins, and wash utensils carefully. Next one is constipation. When stools become hard or stools doesn't pass for 2 or more days, this condition is called constipation. Causes: withholding bowel pressure, excessive water absorption from undigested part of food in the colon, slow movement of undigested part of the food through the alimentary canal, leading a lazy life, intestinal disorder, and not eating food containing roughage are the main causes of constipation. Prevention: to prevent this disease, the things to do are: eat fibrous food, drink enough water, regularly eat vegetables, fruits, apples, bananas, coconuts, dates, orange, papaya, pineapple, etc. Next one is gastric and peptic ulcer. What is ulcer? Ulcer is the inflammation and source of the stomach or the intestine. Causes: the main reason of ulcer is a bacteria named Helicobacter pylori. Beside this, irregularities in taking food, taking spicy food may cause peptic ulcer. Prevention: eating easily digestible food regularly, avoiding spicy and oily food, drinking boiled milk, avoiding coffee and cigarette, etc. may helpful in preventing this disease. Next one is appendicitis. What is appendicitis? In the right side of the lower part of the abdomen, a finger-like pouch joins with the cecum of the large intestine is the appendix. Infection in the appendix is cause of appendicitis. Symptoms: pain around the navel, loss of appetite, vomiting, and constipation are the symptoms of appendicitis. If the situation demands, patients should be taken to the hospital and the appendix should be removed by surgery. Next one is the worm related diseases. Worm live in the body as parasites. The human body is the host for the different kind of worm like roundworm, uh, tapeworm, etc. Symptoms of worm related disease: abdominal pain, weakness, indigestion, insomnia, loss of appetite, pale face, anemia, swelling of hands and legs, and enlarged abdomen are the symptoms of worm related disease. Prevention: eating raw fruits only after proper washing, washing hands properly before eating, use sanitary latrines, not walking barefooted, semi cooked, or don't eat semi cooked food. Next one is diarrhea. What is diarrhea? If anyone suffering from loose motion at least 3 times in a day, this is of diarrhea. Diarrhea is a very common disease in our country. Causes of diarrhea: diarrhea caused by drinking impure water, eating stale and dirty foods, using unclean utensils, intake of food with dirty hands may spread this disease quickly. Diarrhea may be caused by germs like virus, bacteria, or protozoa. Rotavirus is one of the main causes of diarrhea. Symptoms of diarrhea: frequent loose motion and vomiting, feeling of thirst, dried up mouth and tongue, shrinking of skin, sunken eyes, etc. are the symptoms of diarrhea. What is the treatment or instructions during to the diarrhea? Continue to drink oral saline till diarrhea stops. Do not stop taking saline even if the patient vomits. Allow breastfeeding for infants. Patients should be given normal food regularly. After recovery, the patient should be supplied extra diet for at least a week. Dear students, I hope you enjoyed today's class, and homework from today's lesson is absorption of digested food. I hope you will able to do this homework, and please submit this homework to your respective subject teacher. Thank you for being with me. Stay home and stay safe. Allah Hafiz.